Hi, this is Dr. Morazy with Minutes for Moms, here to give you more practical pediatric advice. Today we are going to talk about over-the-counter medicine. So we're going to first talk about Tylenol. Tylenol and acetaminophen is the exact same thing. Tylenol is the name brand. That's what we're used to hearing. Acetaminophen is the generic of it, but it's the exact same thing. So when you are going to buy Tylenol, I tell people stand where the Tylenol is, and right next to it you'll see acetaminophen. I want you to buy acetaminophen because it's going to be cheaper. The other thing that you're going to see when you're buying the liquid Tylenol, you are going to see infant as well as children's. Well, if you look at the active ingredient on the back of the bottle, it'll say active ingredient acetaminophen 160 milligrams per 5 mLs. It'll say that on both the infant bottle as well as the children's bottle. Well, that means it's the exact same medicine. But if you look at the price, the infant is more expensive than the children's. So I tell all my patients, you want to buy children's acetaminophen because it's the exact same dosing. The things that I tell people you want to do with Tylenol when you're going to give Tylenol is it is something that is safe to be used every 4 hours. They don't recommend using more than 5 doses in a 24-hour period of time. You're going to look on the bottle, the back of the bottle, and it'll actually give you how much that you are allowed to dose with. But the times I tell people I want you to reach for the Tylenol is, number one, if your child is under 6 months of age. And I typically say, at 2 months of age, sometimes I might go over it. But if you're thinking you need to give your child Tylenol at 2 months of age, typically I tell you to call your primary care provider because we want to know what's going on. But really that age 3 to 4 months, if you're having to do that Tylenol, it's okay to do that. So Tylenol is something that you can do under 6 months of age. The other times I tell people I want you to reach for Tylenols if you're dealing with the stomach flu, because Tylenol on an empty stomach does not irritate your stomach. Some of the other medicines do. And then the other thing is if I'm dealing with a head injury. So if we've fallen down the steps or we have some big bump on our head and we've got a headache, you can do Tylenol because it doesn't really affect what your platelets are doing. So kind of those are all your kind of do's and don'ts of Tylenol. The other medicine that we'll go over is your ibuprofen. So what you are familiar with hearing people talk about is Advil or Motrin. Well, Advil or Motrin is the name brand of ibuprofen. So ibuprofen is the generic name of that. So when you're going to go buy some of that, you are going to find Advil or Motrin in your pharmacy, and then right next to it you're going to find ibuprofen. Now the tricky part with your liquid ibuprofen is there is a difference between both infant and children's. So if you look at the back of the bottle of infant ibuprofen, it'll say 50 milligrams per 1.25 mLs, and your active ingredient of that is ibuprofen. If you look on the bottle of the children's ibuprofen, it'll say 100 milligrams per 5 mLs, so it's just not as concentrated. So the times that I tell people that I want you to use ibuprofen is a really, really good medicine, but it's not safe to use under 6 months of age. So I never want you to use ibuprofen under 6 months of age. Other than that, that's my go-to medicine. If your child has ear pain, if your child has a sore throat, if your child has broken a bone, really ibuprofen is your number one treatment when it comes for pain. It also does a really, really good job with fever control. It also does a very, very good job when you don't feel good. So it kind of takes those muscles aches, those kind of, I just feel yucky feeling away because it's got non-steroidal property. So it has anti-inflammatory properties. So that helps when you don't feel good. So your go-to medicine after you hit 6 months of age is going to be your ibuprofen, except, remember, if we've got a head injury or if we've got the stomach flu. Other than that, ibuprofen really is going to be your go-to medicine. Kind of same thing, I'm going to defer you to what it says on the bottle. But that's something that you can dose every 6 to 8 hours. And your other thing that you're going to do is your primary care provider can kind of give you that guidance on what to do from a dosing wise. Sometimes if your child is sick and we've got a really, really high fever, we will give you guidance on kind of alternating medicine. And what I mean by that is when you alternate medicine, that means I can give my ibuprofen, You're going to follow that dosing on that. And then 3 hours later, I can give my Tylenol. And then 3 hours later, I can give my ibuprofen. And then 3 hours later, then I can give my Tylenol. So what happens is there's always something in your system that's kind of keeping that fever and kind of that I feel sick feeling at bay. But your ibuprofen is staying 6 hours apart, and that's your bare minimum. And your Tylenol is staying 6 hours apart. But you know, your bare minimum with that is 4 hours. But with that, you're staying on a routine, and that is how you can kind of take control of what's going on with the illness of your child. Now, the thing you got to remember fever-wise, because that's what a lot of times what we do when we dose those medicines, is a fear of ours as a parent is my child's going to get brain damage because that fever goes so high. Well, if you are developing neurologically normal, that's an old wives' tale. Your body does a good job keeping that at check, and it does not give you brain damage. So that is kind of checks off our list when it comes to our fear of fever. And the other one is a febrile seizure. So typically a febrile seizure doesn't happen after my fever has been doing this. It usually happens at the very beginning of an illness. So a lot of times most people don't even know that their child was sick or that their child had a fever. They had a seizure, and then they start kind of getting that fever. So my febrile seizure is not far into my 1 to 2 days of fever. It's at the very, very beginning. So those are typically the two reasons why, as parents, we chase that fever, but know very well if your child is sick and they've got a fever, if they're miserable, you're miserable. So that is your guidance for your nonsteroidals and your acetaminophen. So I hope this gave you nice practical pediatric advice about some over-the-counter medicines. Once again, I'm Dr. Morazy with Minutes for Moms. Please give me a like. Now you know what I know. Until next time.